Welcome back to another whiteboard chat, and today we're going to do part 2 of the GI map overview. On part 1, we had talked about just overall bacteria, H. pylori, pathogens perhaps. I'll go back and look and see what was in part 1, but this is the second part of the test, of the GI map test. So we're going to go over 2 types of bacteria here essentially. Next time we'll probably move on to yeast and some autoimmune areas and kind of round it out there, or may split it into a 4th part depending on how long the videos are. So anyhow, in this section we're going to look at what we would call normal bacteria and what we would call opportunistic or overgrowth microbes or bacteria. So I kind of touched on this a little bit in the first segment, but I'll go over this again real quick. So essentially, normal bacteria, just as the name implies, are going to be bacteria that we would like to see in the gut. These are, are beneficial bacteria. These are the things that we want in, specific higher amounts. Opportunistic bacteria, or overgrowth, or dysbiotic, or whatever name you want to give them, are bacteria that aren't necessarily abnormal, but they are bacteria that in higher amounts could potentially cause sickness or cause disease or cause issues, okay? The term opportunistic would kind of imply that these bacteria, they do very well at using energy sources that come into the gut. They feed very easily, so that's why they can overgrow. So what we may see are a few different scenarios that would really kind of cause a dysbiosis or cause a problem, and I'll go over those in a minute. But with the normal bacteria, trillions of different microorganisms inhabit the human intestine. And I say trillions, talking about like a total of trillions, but there are, as far as types, it's more probably like billions. And then there's obviously a lot of each of those types. So you're obviously not going to be able to test all of them on any test, probably now or ever, I suppose. But we look at the main types that we have research on that are most abundant and are most beneficial, or inversely most problematic. So that's kind of what you will see on the test. Obviously, they're not going to be billions listed on there. So these will extract nutrients, energy from our diets, which these can extract nutrients as well. Maintain gut barrier, so that would be the permeability portion of the gut and GI tract. Produce vitamins in some cases, biotin, vitamin K, there's a few others. And protects against colonization by pathogens. So again, we need these to protect us from these, and there's a balance there. And I'll talk about that. The overgrowth or dysbiotic bacteria does not cause disease in all folks. So just because you see an overgrowth, like if, for example, if you were to look at a GI map and you see there's clearly an overgrowth, some people aren't really symptomatic, or their symptoms are so mild that it's pretty difficult to tell. Now, is that to say that you should not address it? Probably not, because over time, obviously, that could cause more overgrowth, and will probably become more and more dysbiotic and eventually cause an issue. But not every person will present illness or symptoms even. Many people come in contact with these opportunistic bacteria and experience no symptoms, like I just said. And again, depends on amounts. These microbes are normal in stool in small amounts. Many experts will consider them normal. So these would be things like kind of these scary things like E. coli, like streptococcus bacteria. Like you will see these things present on a lot of these, on a GI map, but there will be like a blood test, perhaps. It'll show you ranges. It'll show you like what's, permissible and perhaps what's not. And of course, in ratio with everything else, you can decide, is this a dysbiotic issue, or is this just a normal small exposure? Because again, a lot of people do have these things present. So and the same with things like yeast, like these things are present. You want to get rid of candida and things like that, which could be true, but in small amounts they are considered normal in the human gastrointestinal tract. At high levels, they will obviously affect vulnerable individuals, cause disease, inflammation, so on and so forth. Now, vulnerable individuals are people that are immune suppressed, that's a big one, overly stressed, already have some other pre-existing condition, so on and so forth. And again, it really depends on like how much overgrowth are we talking about. That's why we see as a main cause of SIBO, perhaps one of the main causes being chronic stress over time. we aren't seeing SIBO caused by dietary issues in a lot of the physique population, because a lot of them, and it could be, but a lot of them aren't really eating poorly, right? Of course, there are cases where they are, or like a larger, more muscular person that's eating more, a high amount of food could cause a dysbiosis. But we're talking about like smaller people, we're talking about females that have this typical like hormone dysfunction and this chronic dieting history. They're not causing these SIBO or these overgrowth or dysbiosis issues from eating too much or eating poorly. A lot of them are not eating much at all. Now, maybe there were instances of binging in there, but that's not probably going to cause a full-blown dysbiosis type of issue. Symptoms may include everything that you would expect, right? Diarrhea, which is loose stools, abdominal pain, constipation. I mean, and they can vary. I mean, there can be some other combinations of symptoms in there too, like reflux type issues. And frankly, it's just going to vary person to person, case to case. And some people will have overlap of things that are caused by indirectly or directly from whatever issue that they have. Colonization may occur when normal bacteria that got cut off, too low, essentially, meaning these things are overgrowing. When intestinal permeability is present in large amounts, too large of an amount, C-zonulin, again, we're going to talk about that. This is leaky gut. These microbes could escape the lumen of the gut and infect systemically, meaning all over the place. So why do we see things like eczema and psoriasis and neurological issues and like all these things, present on the skin and present in cognitive function and all this? Well, it's because these issues are now not localized, they are systemic. So we can see that. We can see that in symptoms, but we can also see it on the test if they present this really high zonulin level. That's going to be really indicative of that. So I talked about ratios and some instances that we could see. I'm going to put those down. So we'll have normal and dysbiotic. So we may see a few different instances. So here, I'm going to just put N and O. N, O, not nitric oxide. Okay, so what you're seeing here, normal down, normal is low, opportunistic is high, normal is that dash is neutral, we'll call it. Opportunistic is high, normal is high, opportunistic is high. Now obviously there could be some case where they're both low or they're both normal, right? But these are the ones we're going to talk about. This one, actually I would say these first two pretty common. If you have a low normal bacteria and you have a high opportunistic bacteria, you have an overgrowth issue and you probably are going to be pretty high chance that you have symptoms. This is typical like SIBO scenario, right? The second one would also be like that. You have a normal level of normal bacteria and you have a high level of opportunistic or dysbiotic bacteria. You still have an issue with the ratio, probably pretty susceptible to having symptoms. These two being most common when you're looking at a GI map with people that have things like, that have any type of gut issue really. Okay. This third one, a little bit trickier, but you will see this sometimes. That is a total overgrowth. That's where all of the bacteria is being fed, but it's growing in a pretty even distribution. This person might be less symptomatic because the normal bacteria is kind of pacing the opportunistic bacteria as it grows. Now, they may still have symptoms, they may be bloating, whatever, but they probably aren't as symptomatic as these two instances, okay? And this would be common in like a high food scenario. Somebody that's just eating really high calories, they could potentially have that because they're feeding up everything, okay? So those would be kind of your common scenarios. This scenario, of course, you can work on by lowering the food temporarily and perhaps some antimicrobials if you really need to bring them down. These two instances would probably require more of a full protocol that would require a kill-off phase and repairing any other indirect issues that are there. So those are our two sections. That's kind of the breakdown of what kind of scenarios you may see, what they mean, so on and so forth. Next time we will dig a little bit more into yeast and a couple other areas, and keep it going.